Welcome to Lagniappe, a program about events, issues, and people. I'm Cory Crowe, joined today by Alice Prophit with the Living Well Foundation. Alice, thanks for being with us today on Lagniappe.
Great. It's great to be here. I love coming to talk with you all.
Well, let's start off here as we do every time. Some folks out there may not know what the Living Well Foundation is and how it was formed. What are you guys?
So we were formed back in 2006 when the local public hospital sold Glenwood Regional Medical Center, and that money, being that it was from a sale of a public entity, was put into created a foundation so that those monies could be put back to the public benefit. And we do that through grants and initiatives and grant cycles and other supportive services to 8 parishes, which is our service area.
And they're healthy living, healthy projects related to health care and things like that, right?
Yes, it's pretty broad. It's called to improve the health and well-being of the populations in those parishes. And that has become pretty broad because after COVID, what types of things affect health and well-being? It could be availability of jobs. It could be access to health care. It could be different types of services in health care. It could be transportation, so education, different things. So the board has looked at a broader perspective while staying within the mission and focus and continue to evolve that as we look at what's happening in the area.
Every year you put out a call or request for projects, and then you pick some projects, have a big luncheon, announce the projects. Tell me a little bit about the luncheon just happened. You're at the point where you've announced the projects. What are some of the big ones this time?
So we did that. We had the biggest grant cycle in the history, I believe, of the foundation outside of what we fund for school-based health centers as separate projects. But we funded almost $1 million this year. We're very excited about that. And we're able to do some big projects that came in as very appropriate requests for the region related to clinical professionals expanding services. And some of those include the fact that we're going to have an emergency response vehicle back in Northeast Louisiana. Now, we funded that back in 2021, but we've had to, of course, do what you call carry that on the books for all these years because of COVID, and it slowed down getting the vehicle because of supply chain problems. Well, we were able to have American Red Cross at the luncheon with us. Karen McCoy came, the North Louisiana Regional Director from Shreveport, and we're going to have, they call it an ERV, Emergency Response Vehicle, based in Northeast Louisiana. And the very night before our luncheon, I had gone to the police jury meeting and made an appeal that be parked at the Ouachita Fire Department on Natchitoches Street in West Monroe, and they stepped up unanimously to vote for that, and the fire chief, Bobby Moore, was very receptive and helpful. And so that vehicle will be based in Northeast Louisiana, but will serve, of course, whatever disaster they get deployed to. So that's something that came to fruition in this announcement. But what we funded in this cycle are large projects. We're putting $100,000 to the Northeast Louisiana Children's Museum at that new location at Forsyth because we're going to help design and build out the healthcare gallery so that kids can interact and have educational exhibits and maybe affect their career choices down the road because there is still a huge gap in healthcare professionals. So that the museum is one, and we're looking forward to working with that with other partners. And then suicide, injury, and prevention with Children's Coalition,
right.
Getting that money out into the schools with professionals who go out with evidence-based programming to inform kids about teens how to interact with adults in a way to report their peers being at risk.
So youth suicide is actually up right now?
Oh, gosh, yeah. 30% of young female teens have considered suicide. It's up 15 to 20% among young black males aged 10 to 24. That's a broad range. So yes, we've still got to address these issues with our kids. And also related to that is suicide injury, is school-based health centers, because that puts mental health professionals right on a school's campus.
So some new school-based health centers, also
yes.
Dental care.
Dental care will come to Ouachita Parish High School pretty soon with our partner there. We just opened a school-based health center, 3 new school-based health centers with Richardson Medical Center in Richland Parish, expanding with Richland Parish Hospital at Mangum, Downsville Clinic will expand and grow a bigger clinic that the community can even access that clinic. So still expanding dental health with ULM and good partners out there.
Speaking of ULM, you were telling me we're speaking with Alice Prophit, Living Well Foundation. Y'all are working with ULM in dementia and Alzheimer's. Tell me what's going on there.
Yeah, the population is it's bigger in caring for patients at home, loved ones. A lot of us have been affected by that. I know personally I have. And so it's affecting the health of not only the patient with the progressive disease, but the caregiver too. So trying to find ways to educate, give resources with ULM, the Gero Institute, and the School of Allied Health, and do more programming across the board with other collaborative partners to stem that effect to health that it's having on caregivers too.
Alice, tell me a little bit about this one. And you and I were talking off the air. I hate to go home and have to cook. I'd rather just get in the car and go to the cafeteria or the McDonald's or whatever. How's that affecting the health of folks?
Well, of course, it's affecting us horribly. And food disparity is still an issue, which is surprising because of the supportive programs and food banks and food pantries and benefit on cards. But what we found is that people don't know how to cook. So you can put food in the fridge and in the shelf, but if you don't know how to look at that and put together a meal, it's a big issue. So it's a new problem we've got to address is how do we teach or motivate when that motivation isn't there because of all the fast food and access to food that's not healthy?
So mom and dad don't know how to cook, so then little Junior just doesn't eat healthy because mom and dad don't know how to cook.
Don't know how to cook. And we've got to address that. It's not just as simple as let's have education classes. We've got to research and study this more to find that.
Alice Prophit with us today, the Living Well Foundation. Alice, for folks to find out what's coming up for you guys and getting involved and all of that, how do they do that? How do they follow along?
Well, you can go to our website, www.livingwellfoundation.net, and you can call us at 318-396-5066.
Alice Prophit with the Living Well Foundation. Again, find out more about this and other events and issues by visiting our website, KEDM.org. Don't forget to like and subscribe to our podcast as well. It's available on all the podcast platforms, and you'll find our videos on YouTube.